It's springtime now, and people are concerned with health, mainly because of allergies having effect on a lot of people around this area. But there are other health issues that people are concerned with and will be addressed here in Montgomery within a few days. Joining me now is Dr. Louis Lambiase of the Heersink Health Center here in Montgomery of UAB. Doctor, thank you for joining us.
Thanks for having me.
Now, there's a seminar that's coming up specifically. It's aimed at health issues, and a big thrust of that is going to deal with mental health. Is that right, sir? Tell us about that.
Yeah, so this is our third annual Montgomery Health Policy meeting that we're having on April 9th at the RSA Activity Center. And we're just thrilled because we've got some really outstanding speakers lined up, and we're hoping to attract people who are interested, particularly in mental health and mental health issues. As you know, that's one of the biggest problems that we have in Alabama, both in terms of the mental health of our neighbors and our citizens, and also in terms of the resources that we have to bring to bear. Alabama is 51 out of 51 in terms of the number of psychiatrists that it has. About one Alabamian about every 10 minutes commits suicide.
51 out of 51.
51 out of 51 because you count Washington, D.C. So yeah, so that's pretty bad. So we're at UAB, we're trying to focus on this, and we're trying to bring some experts together to talk about various issues in mental health. So we have a number of events planned. We've got 3 speakers lined up for the health policy meeting. The Secretary of Mental Health, Kimberly Boswell, is going to come and participate in a panel talking about what's going on and what Alabama is doing right now to combat mental health issues. We're bringing Frederick Vars over from the University of Alabama. He's a law professor who is a specialist in suicide prevention, and he's had laws passed in 5 states where people who are feeling like they may be a danger to themselves can voluntarily turn their guns in or be on a do not sell list, and then when they're feeling better or their mental health is resolved, they can take themselves off, purely voluntary. And he has some data from the Alabama VA where people have said that this might help prevent suicide. And then our keynote speaker is Kenneth Rosenberg, who's a psychiatrist from New York, who's also an NYU filmmaker, and is an expert on the care of acutely psychotic patients and people who have acute mental illness. And he's produced a film called Bedlam, which is a documentary showing about how hard it is for these people to get care. These are the folks that you see out on the streets and in the byways and highways of the area, and it's just hard for them to get their care. And so his film documents that. And so he has some ideas for solutions, and so we brought him by. One of the interesting things this year is because we have Dr. Rosenberg coming into town, we're actually going to screen his film for free at the Capri Theater on April 8th at 5:15 p.m. So really kind of very exciting stuff.
Now, this film has gotten some accord already, has it not, sir?
Oh yeah, it was presented at Sundance. It's won awards for best documentary at a number of places, and actually has screened on or streamed on the usual internet streaming services like Prime. But yeah, we're really thrilled to have the opportunity to show it here and then have Dr. Rosenberg available the next day to discuss it and answer any questions or anything like that. So it's going to be interesting.
And the name of that movie again is?
Bedlam.
Bedlam.
Yeah.
Is it a telling sign that people, citizens, are talking more about mental health? Because there was a time where it was something that people weren't comfortable with talking about, but now it is.
Yeah, and I think there still is a bit of a stigma, but I think it's going away, which is good. And I think a lot of people's both mental health, their ability to enjoy life, and their ability even to feel well is impacted greatly by their mental health. And what I would say is it's a really good thing to get rid of the stigma. If you broke your leg, you'd get it fixed, right? If you have an issue with your mental well-being, you should get that addressed too. So I'm really happy that we're able to talk about it. And now the question is, how do we make sure that people feel comfortable? How do we have adequate resources and that sort of thing?
And this brings me to what our lawmakers are doing, because it has been a topic, and in some cases, the Speaker of the House, Nathaniel Ledbetter, has said this is something that we need to address and we need to work on, and Governor Ivey has also agreed that it is. You see more and more agencies touching the subject of mental health and what to do and how it affects their operations. I know Ms. Boswell has been very busy talking with different agencies, if you will, and also going many places to talk to people about why it's important, opening new centers to help out with healthcare as well.
Yeah, and they've been, for example, there have been several things here in Montgomery that have been a result of the legislative action last session. For example, we at the UAB Montgomery Medical Campus have started a new psychiatry residency. So we're going to train young doctors to become psychiatrists, and we were fortunate to receive the support of the legislature last year. UAB has also opened a new residency in Huntsville as well. And there's going to be a new one at the University of Alabama and Tuscaloosa campus next year. So 4 years from now, we just matched our first class here in Montgomery. So our new interns in psychiatry will start in July, and we'll have our first new Montgomery minted psychiatrists in 4 years. Hopefully we can recruit some of them to stay in our area.
And this is a big step
Huge.
in the efforts to help with mental health in this river region.
It's huge because right now a lot of institutions that are tasked with taking care of our people with mental illness don't actually have any psychiatrists available. So this is huge, and I'm very thankful to the legislature for supporting this last year. And there's actually a bill in front of the legislature this year to use some of the opioid settlement money to fund additional residency slots, and we're very grateful that they're considering that.
Fine-tuning people to be more specific at handling cases that deal with mental health issues, because at one time people would say, well, if there was a problem dealing with someone who may have some mental health crisis, if you will, call the police. They may be called the paramedics. But now you have people who are, correct me if I'm wrong, sir, fine-tuned to help address issues, acute issues with someone who's dealing with a mental health crisis.
Yeah, I mean, sadly, the very often still in 2025 in Montgomery, the police and the emergency room and EMS are where those things are being dealt with. But there are people who could deal with it, and then that's really our job, is to get more of those folks into this region, and so that we can deal with it.
Are you seeing, offhand, a influx, if you will, of students coming in, looking at this particular avenue of a career of study for them?
Yeah. Well, our psychiatry residency received 500 applicants for 3 spots. So we interviewed 100 people, and we just matched. So yes, I would say I think 10 students from UAB's class of about 190 students went into psychiatry. So I think that's really important. And then our chief of psychiatry, Dr. Will Rutland, has just started in partnership with the city of Montgomery a street psychiatry program where we get to go out and meet the people where they're living, unfortunately, and provide care there to help them get back into some semblance of a more normal life. And that has been extremely popular with the students and with people who want to go into the field. A lot of our students are extremely altruistic, and so it's our job and goal is to give them an outlet for that. And so we would, like I said, the psychiatry residency is one way. Looking at other ways to support mental health is another way, and then the health policy meeting is a way where we can all meet and discuss and try and come up with ideas for our policymakers.
And a conference like the one that's coming up in Montgomery is another avenue.
Exactly.
Now, when it comes to getting the word out, not only here in Montgomery, but as you noted, several other cities, Have you been hearing from other cities with interest of what you're doing and what could possibly be done to help with this issue?
Yes, well, obviously UAB is a statewide institution, and so we've, as I said, in Huntsville they started another residency. Obviously, the main UAB campus has a large and very successful psychiatry residency. One of the things that I think is interesting is we just started the street psychiatry program here in Montgomery several months ago, and already Birmingham has reached out to us and has said, hey, what are you doing? How are you doing it? And can we use some of your methods? And so Dr. Rutland, I know, has met with the city of Birmingham, as well as working with the city of Montgomery to try and help there.
That has to be an attention getter, to say the least, that lawmakers, city leaders, state leaders, community leaders, and citizens themselves are paying more attention to, like we talked about just a second ago, paying more attention to this issue.
Yeah, absolutely. Absolutely. They are paying attention to it, and the real question is can we do something that shows results? And that's really what we need to do, and be thoughtful about it.
A couple of months ago, there was an opening of a new mental health center in South Central Alabama, and there were tons of people from the community who came out. There were some state leaders there, Governor Abbey was there, and other leaders, but the people of the community who came out by the droves. And a lot of times they were telling us, we really need this. We haven't had anything like this in this area, and we will have to drive to places like, maybe someone within the nearest biggest hospital, I think Dothan or Troy or Montgomery, to get some help in this matter. And they were genuinely happy to see this come to their area.
Yeah, I think that those are the kind of things that we need to think about, how to best use our resources to try and help benefit everybody. And I think it's really an important consideration, because to me, mental health is a huge determinant of people's quality of life. And as I said, if you had frostbite, you'd get in out of the cold. If you had a broken leg, you would deal with that. If you have a heart issue, you'd get that dealt with. So we should also deal with mental health issues. And I think, fortunately, the days of sweeping that under the carpet and ignoring it are going away.
The date for that conference again is?
The conference is April 9th. It starts at 8 o'clock at the RSA Activity Center. The movie is at 5:15 on April 8th at the Capri Theater. All free.
He's Dr. Lou Lambiase of the UAB Health Clinic here in Montgomery. Doctor, thank you for joining us.
Thank you for having me.
I appreciate it.
Thanks.
We appreciate it. Thank you, sir.
Take care.
And Capital Journal will be back.